Should fluoride be added to our water? Is it creating diseases like ADHD, lower IQ, joint problems, or is it doing the work of preventing serious cavities, or both? Hello, beautiful people. My name is Dr. Azadeh Khatibi. I'm a fellowship-trained, board-certified physician, teacher, filmmaker, health, freedom, and mindfulness advocate, and I'm here in my kitchen, a room that plays an essential role in our health. And I'm diving in to what I call the Great Fluoride Debate on this episode 4 of Within with Dr. Azadeh Khatibi, MD, MS, and PH. Robert F. Kennedy announced some months ago that the Trump White House would advise all U.S. water systems to remove fluoride from public water, and OMG, some people are in uproar and they're bemoaning what's going to become of our dental health. And also, some people in media outlets we know are politicizing what is a scientific matter. They're either reactively saying no to everything that RFK Jr. wants to do, or just reactively blanket embracing whatever he wants to do, both of which are foolhardy. So let's be thoughtful and deep thinking about these things. So if you're confused or just want to know more in this great fluoride debate, I'm here to clarify for you what I think are essential points to be considering. Now, I haven't used fluoride in several years. I use something else, which has been proven to be just as effective and has decades of use behind it, and it's naturally found in your body. And I'll tell you all about it. But before I do that, I want to lay the groundwork so you understand the thought processes behind my decision. So what is fluoride? Fluoride's an element. You can find it on the periodic table of elements. Sometimes it's naturally found in water. Sometimes it's not. It works by 1, inhibiting tooth demineralization, 2, promoting tooth remineralization, and the third mechanism of action in preventing cavities is it inhibits plaque bacteria when the bacteria are producing acids that are eating away at the tooth enamel. Now, to understand how we got to fluoridating water, we need to understand some history. Back in 1901, a dentist named Dr. Frederick McKay started investigating Colorado brown stain, a phenomenon where people in some Colorado cities had these terrible brown stains on their teeth. And after decades of research with him and another researcher, Dr. G.B. Black, they discovered it only affected people whose teeth were formed while living there. So people who lived in other places while their permanent teeth were being formed weren't affected. They also found that these teeth were inexplicably resistant to decay and cavities. And after a 30-year quest involving multiple curious, skeptical, hardworking, deep thinking people, it was discovered that it was the high levels of fluoride in the water that caused the discoloration of the tooth enamel. So the brown staining on the teeth that were super resistant to cavities was fluorosis from fluoride. Around 1944, it was reported that topical fluoride reduced cavities by 30 to 40%. Now that's pretty considerable reduction, actually. More research showed that fluoride levels up to 1 part per million in drinking water did not cause enamel fluorosis, that brown staining, in most people, and only mild enamel fluorosis in a small percentage of people. So if you want to find out about the dosing specifics of fluoride and the harms, I refer you to the article, The Role of Fluoride on Caries Prevention, which I will reference in my Substack for this episode, episode 4. So even then, as scientists and public health officials were considering the intervention of putting fluoride in the water, they knew that they were going to harm the teeth of some children, and they were okay with that. They found that acceptable, and that's public health for you. Its modus operandi puts the needs of the group before the needs of the individual. So the public health apparatus wanted to test the intervention of fluoridating water on cavity prevention on a mass scale. And in 1945, Grand Rapids, Michigan became the first city in the world to fluoridate its drinking water in a study sponsored first by the Surgeon General of the United States, and then it was taken over by the NIDR, the National Institute of Dental Research, part of the National Institutes of Health, the NIH. During the 15-year project, researchers monitored the rate of tooth decay among Grand Rapids' almost 30,000 school children. After 11 years, they announced a 60% decrease in cavity rate after fluoride was added to the water. That's a huge scientific breakthrough. They found a way to prevent cavities on a mass scale, and they had the proof, they had the intervention that they knew had a huge effect, and they were super excited. But of course, as we know, science and the scientific process with its iterative and controlling foundations has a tendency to become myopic and only focus on the variable or the few variables it's intervening on to the detriment of studying or considering the whole picture. So what about general health, the short and long-term mind-body health of the children, the health of the adults in Grand Rapids, Michigan? Well, in May 1957, Dr. Francis A. Arnold, who was the director of the NIDR at the NIH, the Department of Public Health Service at the U.S. Department of Health, Education, and Welfare, published an article entitled Grand Rapids Fluoridation Study, Results Pertaining to the 11th Year of Fluoridation. In it, he reported on the various fluoridation studies that the U.S. government had been doing up to that point. And he specifically mentions the importance of safety testing. And he wrote, generally speaking, all of the studies referred to are designed to evaluate what, if any, effect fluoridation of a public water supply will have on the general health of the community using this supply. This public health responsibility has been foremost in the minds of all people concerned and has been recognized by everyone involved in initiating or endorsing such programs. But I highly suspect he wasn't speaking truthfully or was otherwise skirting responsibility or trying to paint things in an overly positive light while skirting over the superficiality of the investigations when he talks about general health. I was able to access 2 of the 4 articles he used to back up his claims of general health being a foremost concern, and neither of them had any protocol descriptions for studying general health of the population exposed to the fluoride intervention. The studies just looked at outcomes on the teeth. If you'd like to dig in further, I'll include those references with links in my Substack article in this episode for you, and we can share the info on the Substack chat and learn and discover together. Maybe you'll find something I didn't find. But my investigation also showed the major variables studied were only in kids, and they did not at all look at the myriad of other factors that could potentially be affected in the exquisitely delicate and complex and beautiful universe that is the human body. Now, you could say they didn't have the funding, they didn't have the ability. But that's a huge limitation of their studies. And given where medicine was in the 40s and 50s, that's a huge cop-out. They should have said that. And anyway, at this time period, now we can and should do better. So we need to do better and study these potential risks in depth. But they ended up using their myopic evidence to add fluoride to the water systems. And now community water fluoridation has been used for over 60 years. And it's in at least half of our water systems, usually at around 0.7 parts per million. So I think getting rid of fluoride in our water systems is a good thing. Why? I have 7 reasons. 1, there's no randomized controlled trial of fluoride in the water that adequately examines the long-term effects of systemic absorption on the minds and bodies of human beings. That study has never been done. To even consider putting fluoride in the water, they should have proven it's safe first to the whole body, with evaluation of numerous physiological and neuropsychobiological markers, variables in testing like blood pressure, heart rate, neuropsychological testing, including IQ, behavior surveys, complete metabolic panel, lipids, bone and joint health, inflammatory markers like CRP, social health reporting, physical health exams, just to name a few things. They didn't do that study. There was no randomized controlled trial. That study needs to be done. Reason number 2, there's no public health control over the individual amount of fluoride a person consumes and is exposed to. And it's very likely causing terrible problems. A child or adult who drinks more water is going to be exposed to more fluoride in their system and the negative effects of that, including fluorosis, bone disease, and other risks. That's why public health departments and water departments in warmer climates decrease the amount of fluoride that they put in the water because they know people get thirstier in their areas and they drink more water. But so many people are all about hydration nowadays, carrying water bottles everywhere, refilling them, So they're likely exposed to more fluoride if they're drinking tap water or water at a restaurant or the school drinking fountain. Data from the National Health and Nutrition Examination Study, the NHNES, indicates that 1 in 5 people in the United States have mild fluorosis staining of their teeth. That's 20% of the population. And 1 in 50 have moderate fluorosis. And there's even data suggesting that fluorosis rates are increasing, with 2/3 of children and adolescents aged 6 years and older having some form of dental fluorosis. That's almost 70% of the population of kids. That's mind-boggling and unacceptable because it's not just the cosmetic effect on the teeth. You can get damage to the body from skeletal fluorosis. It causes joint pain, joint stiffness, osteoporosis, muscle wasting, and neurological defects. I'm very concerned about the increasing higher rates of dental fluorosis, up to 70% in children, as a marker that we are experiencing increased skeletal fluorosis and all the negative muscle and bone problems that come with it as well, plus other things aside from skeletal fluorosis. Fluorosis is also associated with, get this, nutrition deficits. It can cause kidney damage. It can alter your thyroid. It can be associated with bone cancer, even although more research is necessary on that. More research is necessary on all of these things, and we may be suffering thyroid dysfunction and other issues from our fluoride exposure. And it gets even worse. There's some data that shows that pregnant mothers with higher levels of fluoride are more likely to have children with neurobehavioral issues, indicating that it may be a developmental neurotoxicant. In 2024, the National Toxicology Program at the NIH reported with moderate certainty that there's an association between higher levels of fluoride, 1.5 milligrams per liter or more, and lower IQ in children. That affects millions of people in the United States. Millions of people. And you know what else is frightening? The publication of that NIH report was delayed for several years. Because it kept being passed back and forth between government and groups outside the government, some of whom were afraid that it would prompt the public to reject any fluoridation at any level. This is gatekeeping of information from the masses for years. Reason 3. Since we started fluoridating water, we now also use targeted fluoride treatments, local treatments on the teeth that are also proven to prevent cavities, including fluoride toothpaste, fluoride treatments, fluoride in the polishing paste used during your cleanings, although you can request non-fluoride polishing paste as well as fluoride mouthwash. So many people may be getting plenty of fluoride already, and that also doesn't include the dietary sources of fluoride like spinach, tea, seafood. So now people, even in areas with low water fluoride, may be potentially overdosing beyond what may be healthy for their individual physiology. Not to mention a vulnerable baby in their mother's womb. We're not just taking it in our food. We're also absorbing it in the shower and in the bath. Reason 4. The Centers for Disease Control and Prevention say research shows that community water fluoridation reduces cavities by around 25%. It's certainly not that dramatic 60% anymore like it was in the Grand Rapids study 80 years ago, because our other fluoride interventions have washed out or watered down, pun intended, the effects of water fluoridation. Water fluoridation is nowhere near as powerful as it used to be in preventing cavities when they made the arguments for the necessity of water fluoridation in our public waterways. Reason 5. Poor people are affected by fluorosis at higher rates. So this is a social justice issue. If you care about social justice, if you care about equity, you should consider water fluoridation very carefully, because poor people are more negatively affected by the risks of fluorosis, not just the teeth, but also the joint problems, the muscle, the bone, the thyroid, the kidney, and likely neurotoxic effects. Reason 6. We don't have to add fluoride to the water because we have systems now where people who want fluoride in their water can just add fluoride drops to their water. Your freedom to not have fluoride, let's say you're concerned because you have children with ADHD, or they have highly reactive nervous systems, or you yourself have kidney problems or thyroid problems. That freedom should be paramount, and the strength of the governmental or public health apparatus should not be superseding that freedom, forcing you or coercing you into unwanted side effects that are sickening, figuratively sickening, and literally sickening. And lastly, reason 7. There's an alternative to fluoride that is proven to prevent cavities, and it's what I use. It's a natural substance found in your own body, hydroxyapatite. Hydroxyapatite is one of the building blocks of bones. It's a stable and biocompatible calcium phosphate that's been used for decades in medicine. In a randomized controlled trial, microcrystalline hydroxyapatite was found to be non-inferior to fluoride toothpaste in preventing cavities in children over a 1-year period. And some data indicates that it may be even more effective than fluoride. It has a different mechanism of action compared to fluoride. It also reduces tooth sensitivity, it controls the oral biofilm, and it also whitens your teeth. It doesn't make sense to want systemic fluoride that is increasingly been found to cause physical harm when you have options like hydroxyapatite you can use at home that also do the work of cavity prevention. Plus, people who want fluoride can just add it to their own water. Now, do I think fluoridated water has a place, for example? Yes, maybe for people who have poor dentition, who are also so behaviorally non-cooperative that they won't brush or floss their teeth or allow you to brush it for them, and their teeth are getting cavities, and that can cause localized and potentially long-term systemic health problems. So you have to do a risk-benefit analysis there to weigh the potential risk of cavity formation and exposure to general anesthesia and the general anesthesia gases that can reduce someone's cognition if you don't fluoridate their water and then they need dental procedures under anesthesia, and also look at their specific diet, their refined carb intake, etc., and then weigh that against the potential effects of fluoride on their bones and nervous system and thyroid, which actually may be affecting their behavior given the potential neurotoxic effects of the fluoride. So it's a lot of information to consider. It's almost mind-boggling, but it's important to do that on a case-by-case basis, not a blanket treatment for the whole population. We also have to take into account that stopping fluoridation may result in an uptick in cavity formation in areas where fluoridation is removed, because we're going to be losing some of that protective effect of cavity prevention. But the data for that is mixed. If it does create an uptick in cavities, how much will the risk of cavities increase? Well, the go-to number is that water fluoridation prevents 25% of cavities. But it really depends on the practices of the population in the city and their dental health programs and the dental behaviors of the population overall and their overall health. I think a more accurate assessment can be made by looking into what happened to cities that stopped fluoridating their water and cities that never fluoridated their water in the first place. An example of that is Calgary. Calgary stopped water fluoridation for a while, starting in 2011, and they stopped because they deemed it too expensive, and then voters voted it back in again a decade later. Now, compared to Edmonton, which never stopped water fluoridation and had a cavity rate in primary teeth of 55.1%, Calgary had a 64.8% rate of cavities. But studies in other countries have shown no increase. So we shouldn't be reactive about this, but we should be wise as individuals and families and groups in thinking about this. It is important to note that uptake in cavities may have more negative consequences for those who have lots of cavities, especially with potentially cancer-causing BPA in some filling material, even though you can go to a dentist that doesn't use BPA, but who knows if that material, the non-BPA material, is going to be found to cause cancer itself in a couple decades. And there's also the potential consequences of infections in root canal teeth on the rest of the body. So we want to avoid these unwanted side effects as much as possible, including formation of cavities in the first place. And that's why we need to also have an oral health education campaign where we humbly tell the people what's coming, why it's wise to stop fluoridation because of the many known concerns now and the unknowns compared to decades ago when fluoridation was started, and empower them with known tools and resources so they can take the power into their own hands. And some families may choose to add fluoride to their water. It's a free country. I wouldn't, but some families may, and that should be their choice. Some countries, by the way, like Denmark and Belgium, don't fluoridate their water, and they have better overall oral health than the United States, but they also offer universal dental care for everyone. And some areas of their countries have high rates of fluoride, and some places have low rates of fluoride. So this is a nuanced discussion, but let's always just go back to keeping in mind the original public health arguments pushing for water fluoridation. In 1953, Dr. H. Trendley Dean, the dental director at the National Institutes of Dental Research at the NIH, reflected on the history and scientific considerations of mass fluoridation, writing, "A scientist can only base his opinion on known, available, observed facts. And these are that there are no known untoward effects developing in millions of persons using water naturally containing fluoride at about 1 part per million. Such evidence cannot be ignored, nor can the fact be disregarded that all the studies thus far conducted to explore these specific points have supported the safety of fluoridation." And in the 1950s, Dr. Arnold, the head of the National Institute of Dental Research at the NIH, said, "In all these studies, particular attention and interest has been paid to any effects fluoridation might have on other biological systems of the body. In none of the studies has there been any scientific evidence to suggest an adverse effect on any segment of a rather large population living under divergent environmental conditions. These observations, in conjunction with the fact that millions of people have used naturally fluoridated water for generations, attest to the complete safety of the procedure." But now, the situation has changed. The data is different. Dr. Dean, Dr. Arnold, we now can base our opinion on known, available, observed facts. And these are that there are known untoward effects developing in millions of persons using fluoridated water. Such evidence cannot be ignored, nor can the fact be disregarded that some studies thus far conducted to explore these specific points have supported that fluoride at levels we are exposed to may be far worse than you guys anticipated, and you guys didn't check the effects on the body nearly as thoroughly enough to even logically think this was okay to do. We've entered this era where we're waking up to the fact that systems and those in power have unethically forced the masses to do things to their bodies they don't want, often without great evidence. And we have to untangle ourselves from the thick binding tendrils of that legacy. It's going to take years to do that, especially to rid the collective's consciousness of that submissive or powerless or ignorant mentality. But it's important to take the steps to act where we can. So I support stopping fluoridation of water with a strong, humble, and transparent public health dental campaign to go alongside it, and support for excellent, honest oral healthcare programs for all children, and call for more research done with joy, curiosity, humility, and replicability. There's so many research frontiers to consider, and it's exciting. I think we can look at things including the oral and gut microbiome and how the presence of certain bacteria promotes or prevents disease, and how antibiotics affect this, and how that affects cavity formation. We need more research on hydroxyapatite and optimum dosing and formulations, nano or non-nano, and further safety testing. We need deeper research on fluoride, its various chemical formulations and safety, and potentiality of neurotoxicity and other unwanted side effects. We need to look at ancient techniques like tongue scraping and oil pulling, which have some data on them already, but to look at their effects on cavities and oral microbiome and gum health. We need to look at the high neurally reactive people who are 20% of the population, but bear so much disease burden in the United States, and look at their rates of cavities and prevention strategies for them, including addressing psychoneurological healthcare strategies. We also need more randomized controlled trials on the effects of diet on cavity formation and oral and gut microbiome and jaw formation across the ages. And we need to investigate new bioidentical materials for filling dental caries. It's an exciting time to be alive. There's so much to look forward to, including new discoveries, and also going back to some ancient ways. And I pray letting go of 20th century interventions that no longer make sense because there's evidence that they may be very dangerous and they didn't have enough evidence to support their implementation in the first place. I wish you, your mouth, your gums, your jaw, your teeth, great ease and great health. And for you, it's great overall health. If you liked what you heard and you want more, please show your support by subscribing, liking, reviewing, and rating this show wherever you're watching, and especially on Apple Podcasts. And share this with your friends, please. It really helps. Be sure to follow me on my socials to keep up with what's going on with me and my advocacy and the behind the scenes of this lady doctor's life. I'm on IG at Azadeh Khatibi, MD, MSMPH, and Twitter at Azadeh Khatibi, MD. I also have a Facebook page, and you can catch me on YouTube and Rumble and Substack. This is Azadeh Khatibi. I'm sending you, until next time, so much love and best wishes for your health.